Hi, everyone, and welcome to World Doc Alan podcast. I'm excited to welcome the program World Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. Today's topic, avoiding maternal mortality. Have you been asked how you managed to deliver 6,000 babies without any maternal mortalities?
Well, yes. Thank you, Neil. A lot of people say it's better to be lucky than good. And of course, you have to say there's a little bit of luck, or maybe a lot of luck. But I'm going to try not to sound too egotistical here. But I think what has to happen is a patient partnership. In other words, give and take. You ask questions, you get answers, and you make further questions depending on what the patient tells you.
From your perspective as a physician, what do you think you did as a physician to prevent maternal mortality?
Well, I think there were several things. I had a lot of fun with my prenatal classes and my courses. I had moms, of course, dads, children come along. So having the entire family was really important. And also listening is important, active listening. You ask a question, you try to answer it, and you try to ask another question. And then, of course, finally, this has to do with access. So I saw the patients as often as I thought they needed to be seen, regardless of what insurance thought or whether insurance would pay.
Why do you see your mothers in your office 1 week after they are delivered?
Well, we're supposed to, according to all the insurance rules and the rules of the American College of OBGYN, 6 weeks is the time we're supposed to see them, and that's because at 6 weeks after delivery, the so-called uterus has shrunk back to normal. Well, by 6 weeks, if you're going to have trouble, you will already have had trouble for 6 weeks. So I saw everybody at 1 week. Of course, insurance never paid for that. I saw them at 1 week because that's the time that people are still not really committed to having a lot of trouble. They're not totally postpartum depressed. If they're headed for psychosis, they don't have it yet, or they don't have much of it yet. So this is the time to intervene and to, what we've said many times, steer your pregnancy.
All right. The best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks again, Doc.
Thanks, Neil.
All right. That was the World Doc Allen podcast, guys. Take care.